Hey, everybody. Thanks for joining myself, Dr. Ross, and the amazing Dr. Chris Turnpaugh for an awesome Turnpaugh Talks with Turnpaugh Health and Wellness Center. Today, we're going to be diving into a really awesome conversation and a very important conversation that can get very detailed and very in-depth quickly. So we are going to try to cover as much information as possible, but in doing so, it's going to be a little bit cursory overview. So if any of our listeners are interested in further detail of some of our offshoot of the topics we cover today, please let us know. Send us messages or emails or leave comments in the comment box for us to dive into some of these offshoots that we're going to touch upon. But the major topic today, we're going to be talking about leaky gut. We're going to be talking about, what does your digestive tract do, how someone gets leaky gut, and then talking about how we can support this condition. So I'm super excited. I know Dr. Turnpaugh is super excited, and I'm going to have Dr. Chris take it away here.
Thanks, Dr. Ross. Hey, it's really a great topic. And the reason is we were talking before we got started here, this can lead to so many offshoots, whether it be, like you had mentioned, like mood disorders, anxiety, depression. It could be something with hormones because your hormones are related to this. It could be related to so many different aspects, adrenals and different things that are associated with gut function and leaky gut. And there's an enormous amount of literature out there. I actually have done a 3-day lecture just on this topic. So we're going to try and whittle it down to half hour, 45 minutes, maybe an hour. Right. So I think it's important if people say, hey, I want to know about hormones in the gut or SIBO in the gut or bloating in the gut or constipation or depression or my heart condition or diabetes. Those are things we can certainly follow up with on another lecture. So what I was going to do is real cursory, just go over digestion so we have some reference points. So for patients and recognizing the importance of the entire digestive tract. So the digestive tract is really like your skin, which is folded inside and then has become very specialized. So if you think about your digestive tract, it's really an external environment which has been folded in, or like a tube that goes through us. And it's really this amazingly specialized piece. So I'm going to state some of the obvious. So for the food to get to our gut, or in this case, we're going to be talking about the small intestine and the different areas of the small intestine, because that's where the gut leaks, so to speak. You can have leaky bowel as well, but we're talking about the small intestine, leaky intestines, we could call it, but they call it leaky gut. Well, it's important to know how the food even gets there. So first we have to chew our food. We tear it, whether we have incisors or canines, we grind it with our molars. Then we kind of make it into this stuff in the back of our throat, this bolus, and then we swallow it. It gets into our stomach. Our stomach churns it like a butter churner. That's what the stomach does. And then it also uses acid in the stomach. That acid in the stomach helps to break down the proteins. And there's 3 particular cells in the stomach that do that. And so we break it down. And then the amount of acid we have and this chyme or this juice in the bottom of our stomach gets dumped into the first part of our small intestine. And the contents and the consistency of those contents help to determine the rest of the digestive process, which is where many people focus on. So here, you're going to get your pancreas releasing pancreatic enzymes, your gallbladder releasing bile. So now you really start most of the digestive process after it gets out of the stomach. The key, though, before we even get there is, did you chew your food? And did your stomach break down your food? Did you have enough stomach acid to break your food down enough? Because that will determine the efficiency of how we break down the food in our small intestine. So then we get into the small intestine. The first part, we break it down. Then the next part, we kind of absorb it. It turns into mostly waste and water. It goes into our colon, and then we resorb it. Most of our bugs that people talk about, these probiotics, they live in the colon. There's a valve that keeps them there called the ileocecal valve. Then it kind of makes an upside down U in your body. We got the ascending colon, transverse colon, descending colon. Then it goes into the sigmoid colon, which is the S, and then goes in the rectum, and we defecate it, and life is good again. So I just want to go through that process because it's important to know that if people focus on leaky gut, but if I'm missing 7 teeth, that could be a problem. If I'm eating too quickly, that could be a problem. If I'm taking antacids or protonics, or proton pump inhibitors or TUMS or anything, that could be a problem later down the road, and that can lead to leaky gut. And then I'm sure you'll hit on, but leaky gut, we talk about leaky gut. You don't have to even have a gut symptom to have leaky gut. So I have a host of like 30 conditions that you would never think would be associated with leaky gut, such as heart failure is associated with leaky gut. So there's a whole bunch of things going on there. And then in the intestines, if this is my intestinal wall, there are these little hair-like things called villi, and that increases the surface area, so it increases the space of our intestines. And then on the villi, there's little hairs, and they're called microvilli. And so, and these cells all kind of come together, look like this, and they're very tightly bound together. And then this is the normal physiology. So it's important for those of us who understand this to know what normal is so that we can recognize what abnormal is. And for the patients out there to know that normally I have all these hairs on top of bumps on top of a wall. And when you get leaky gut, that's what starts to deteriorate. Yeah. So that's my brief, instead of 4 years of gastroenterology, that's the 5-minute discussion on how things get digested. So
I love it. And that was perfect. And so one of the things that you touched upon, Dr. Turnpaugh, was great and this is, I think, as us as practitioners and other clinicians listening, probably frustrates us the most is, well, my gut feels fine. I don't have any digestive symptoms, but your sleep's a mess. Your hormones are a mess. You've got bouts of depression and high anxiety. And, right there, that's enough information for me to say, hey, something's wrong with your gut, right? Just because I'm not having constipation, diarrhea, bloating, gas, acid reflux, doesn't mean that your gut is in wonderful shape.
Yeah, so important. There's some published studies that say you can't get an autoimmune condition until you get a leaky gut. Mm-hmm. So we know that autoimmune disease affects 35 to 40 million Americans, and so it's the number one dysfunction in the country today. And so there's papers that have been published saying you cannot get an autoimmune condition until you get a leaky gut. Now there's some controversy about that, but certainly we could take from that that leaky gut is highly associated with autoimmunity in the absence of a gut symptom. So if you have Hashimoto's thyroiditis or a thyroid condition, 90% of thyroid conditions in America are autoimmune, people aren't complaining of their gut. And there are, I'll probably give them to you to reference too, but major depressive disorders should first be checked for leaky gut. So again, standard of care for psychiatric medicine should be check your gut if you have major depression. If you're on an antidepressant, the only reason you ever go on an antidepressant is for major depressive disorders because they're not clinically indicated for mild depressive disorders. So if you're on any kind of antidepressant, you should have been assessed, addressed, and evaluated and supported for leaky gut. And I don't know about you, I do. None of our patients that come in on these medications is, oh, well, we first address the leaky gut before we put you on your Lexapro or your Paxil or your,
Right. Exactly. Every one of those patients should have had a poop sample. Yes, you should be playing with your poop. But I want to bring back another really great point that, and we'll dive even further in because it's so important to address. And I think with the past year that we've had with COVID, I think it's been, addressed pretty fairly that there is such a strong connection with the immune system and our digestive tract, right? They are very tightly regulated. As you mentioned, Dr. Turnpaugh, there's without an autoimmune condition, it is very, very likely, highly likely, there is susceptibility to your digestive tract. But coming back to a really great point that you talked about, and I want to dive in this just a little bit deeper. We could go all day into this topic because there's such, I think, dichotomies on this one in regards to you don't have enough stomach acid, you have too much stomach acid. But you talked about stomach acid. And I think that's a really crucial point that we dive into a little bit more. So can you give our viewers and our listeners just a little bit more detail in the pathophysiology in regards to stomach acid and how crucial it is for stomach acid to break down our food and also signal our enzymes and then also cause our pyloric sphincter to open, right?
Yeah. So there's, in our stomach, we have kind of almost like a two-part epoxy. You get your hydrochloric acid, which is really, really strong acid, and you get something called pepsinogen. And pepsinogen is kind of the not ready to break a protein down.
Mm-hmm.
So you have pepsinogen, anything that says gin on the end is not ready yet. So the acid hits the pepsinogen becomes pepsin, and now pepsin can break down proteins. But in and of itself, the pepsinogen or the hydrochloric acid is not what's breaking down the protein. So you need to activate this guy, this pepsinogen, to break down proteins. What activates it is hydrochloric acid. So when you take any kind of antacid or acid blocker or inhibitor or anything like that, you're not able to break down protein. Now, protein for me, I'm a simpleton, is bricks and sticks. So they're your building blocks, right? They're your amino acids and your building blocks. And then with this acid, when it sits in the lower portion of the stomach, it becomes something called chyme. And then that triggers the sphincter to open, or the chute to open up, so that the chyme can go into the small intestine. And the level of acidity of that chyme will then trigger the pancreas, which makes digestive enzymes, which many people are taking digestive enzymes because they don't have enough. They may have plenty, but they're not being told to work, right? So they have plenty of enzymes in their pancreas, but they're just not being told to work. So the pancreas then releases enzymes, and that also triggers the gallbladder to flush, or if you don't have a gallbladder, the liver to make some additional bile salts. And so now we get this massive fat emulsification and breakdown of our carbohydrates, fats, and proteins based on our pancreatic enzymes as well as our bile salts. And so that emulsifies the fat. But that is because of what happened in our stomach that triggered that next response. Yeah. So it's a constant question of, well, I'm bloated, I'm this, I'm that. Are you, again, going back to, are you chewing your food? And then when it gets to your stomach, do you even have enough stomach acid?
Right.
And so if you have, so as we age, we produce less stomach acid. And it's a big long term called hypochlorhydria, which means I don't have enough stomach acid.
Right.
And so, but it's kind of the joke, when you take Tums, it means you're old. Well, if I need Tums when I'm older, but I'm not making enough stomach acid, then we're thinking about it maybe incorrectly. Right. This is my thought. Remember, the stomach does two things. It churns, so that's the mechanical breakdown, and then it's a chemical breakdown. So if you have less chemicals in your stomach, less acid in your stomach, you churn more, and you tend to splash it up into your esophagus. Mm-hmm. And here's another key point, which we is also understanding posture is very important. The diaphragm, I don't want to belabor this, but I think it's super important. Yeah. Your esophagus comes down, and then there's a trap there, a sphincter. But that sphincter is unique because it's really made of your diaphragm. So if you think of this flank steak at the bottom of your rib cage, turn this down a little bit here. So you have your diaphragm here, and if we turn it sideways, there would be a hole in it, and that hole would be where the esophagus goes through. Yep. So esophagus comes through like this. So here, my thumb is my esophagus, my knuckle is my stomach, and we get something called a hiatal hernia when it pops up through. But what holds that all in place is the diaphragm. The diaphragm holds that in place, and the diaphragm makes that hole where the esophagus is. So that diaphragm is super important. It's a ginormous muscle, and it's for breathing. Yep. And it attaches all through your spine. So it attaches all down to L1, L2, L3. It attaches up. And when you breathe, it goes down, and you exhale, it comes up. It's all this massive movement. And it's that muscle is what is over the esophagus, right? So sliding up and down, sliding up and down. So let me walk you through some pathology, which is pretty easy to understand. I have some heartburn, so I take Tums, or it's really bad, I take omeprazole or Pepcid or
Yeah,
Nexium or any one of those things
Protonix.
that are all over the, and we reduce our stomach acid. Well, that reduces the breakdown of protein, which is bricks and sticks, which cause the tissue to repair. That reduces the ability to break it down in my small intestine because I didn't trigger my pancreas and my gallbladder to facilitate that.
Yep.
And maybe, just maybe, that's because as I aged, my posture got bad.
Right.
Well, if my posture gets bad as I age, so does how my diaphragm works.
Right.
And if how my diaphragm works affects how my stomach is working,
Right.
you could have stomach acid problems as a consequence of poor posture, which has led to leaky gut, which has facilitated autoimmune disease. So that's why it's super important to look at all the aspects of it. And I didn't want to go down a rabbit hole
No,
there,
that's
but it's so
great.
important. Yeah.
Yeah, that's great. I mean, I couldn't agree more, Dr. T. And I can't tell you how many patients that I have that come in that say, I have, it feels like there's a bulge or a knot here. And of course it's a sliding hiatal hernia. And being doctor of chiropractic, they do a good job of showing you how to deal with that. But if you don't underline the root cause, the sliding hernia just pops right back in. And almost 99% of the time, all of my sliding hiatal hernia patients have, guess, you know what? Acid reflux,
Yeah.
right? And poor posture, obviously,
Right.
right? So that breathing mechanism, that diaphragm that Dr. Turnpaugh talks about is like a big giant like vat with a cap on top and a cap below. Cap on top is your diaphragm, cap below is your pelvic floor, right? So really important that you have someone going and talking about proper breath work, making sure you're not a chest breather, making sure you're a good belly breather. You should be, if you're exercising, focusing on, what I tend to do for my warm-ups is I do a couple deep breaths. I put my fingers at the bottom, just at like my belt line, right? And I make sure I put a little bit of pressure into my stomach, and I give myself about 5 good deep breaths to make sure I'm breathing correctly. And when I'm breathing in, and I'm inhaling, I'm pushing my fingertips, they're at the bottom of my belt line, out to make sure I know I'm getting good diaphragmatic breathing and good activation of my abdominal muscles, right? So that's one of those aspects that you can try and implement. Well, how do I fix that? Work on your posture, shoulders down and back, head, slight chin tuck, and then work on that big belly breathing. Push your fingers out that are resting on your waistband, not at your chest. And I also wanted to, again, talk about the fact that you hit on, Dr. T, chewing, right? We are caught in the rat race, right? Constantly caught in the rat race. And I'm to blame for it sometimes as well, that we just quickly shovel some food in and we're on to the next thing. I would like our viewers to work on being mindful what's on their plate, connect with their food, turn the TV off, turn turn your computer screen off, put your phone down, be mindful what you're eating, and get about 30 to 40 bites each, mouthful of food, and making sure we're starting that digestive process. And as you know, Dr. Turnpaugh, digestion doesn't start just from when we put food in our mouth. When we visually see the food, we visually smell the food, our body is starting to already produce enzymes. Our mouth is starting to actually produce amylase, which helps to break down carbohydrates. So there's a lot of key factors that go into digestion before we even put food into our stomach or in our
Right.
mouth. Right. So
And if we're just in a quick, just running past eating something, we didn't give our body the fair chance to digest it correctly, like you said, because it's like, oh, it's going to sit down, get ready to eat, start the process, put the food in the mouth. The food in the mouth, the amylase will break down some of your basic carbohydrates, which then you taste as sweet, which gives you a sense of satiety, and then you swallow it down. All that is a process, and we just inhale. And I'm guilty of it, like you said. I'm guilty. Inhale, go on. So it should really be an important part of our lives. As diet and nutrition plays a role in all chronic disease, we should probably give it a little bit more respect than even I do when I'm eating.
Yeah. And real quick, I just wanted to quickly just cursory overview that last about 15 minutes there. So for our viewers, Dr. Turnpaugh just talked about the importance of stomach acid, right? So, and again, there is those kind of two side philosophies that, for most typical gastroenterologists, if you're coming in with acid reflux or heartburn, here's a Pepcid, here's a Nexium, here's a Protonix, so some type of either antacid or PPI, which is known as proton pump inhibitor. All of these block acid production. And so that, in theory, stops the burning. And the other side of it, the other spectrum that Dr. Turnpaugh mentioned, is that we don't have enough stomach acid. So therefore, our stomach starts trying to work harder to produce, it starts churning more to produce stomach acid. And that's where we get our reflux, right? So that was said awesome. I thought that was a really good recap. Now, Dr. Teeve, someone comes in with potentially leaky gut and has got some acid reflux. Where do we think that's coming from? What are the initiating factors of that? What's the pathophysiology that started this, you feel, for most cases?
So that's a great question. And it's that's not a one answer, but
right.
First I'd start just like you did. Are you breathing and how's your posture? So is that stomach acid irritation coming just from poor posture and poor breathing? So that's simple, right? Let's assess your posture, address your breathing. Some people think it's frou-frou. Oh, you want to do breathing and posture. No, it changes your physiology. So I think assessing, addressing breathing and posture. Are you chewing your food? Are there limitations? Do you have teeth? Do you sit down? But then we have to assess, is your stomach, do you have a hiatal hernia? Well, that's one thing, which many people do due to poor posture. Also overeating, when we stretch that stomach too much, it has to go somewhere. So it's going to blow up through so eating too much or overeating, eating too quickly. So we're overeating. So we eat too quickly and we don't realize our stomach was full in time. And then you have to say, well, are you breaking your food down? Do you have enough stomach acid? And many times, it's been around for as long as the days are, taking some apple cider vinegar before you eat to, increase your stomach acid. Risk factor I always put out is, if you do that all the time, you're going to take the enamel off your teeth because, but so people say, oh, shot of apple cider vinegar helps me digest my food. What they're saying to you is, I need more stomach acid.
Right.
So you can use a beta HCl, a weak stomach acid, which many people use, I know we use. And then you can also help the body kind of not be under such attack by supporting it with digestive enzymes. So you can use some supporting digestive enzymes. But I think you kind of touched on it a little bit earlier. We want to know why you're feeling this way. So do we need a stool analysis? Do we need to see what kind of bad bugs are living in there? Do we need to see, how you're affecting? So once we get beyond the stomach, we need to ask, well, even in the stomach, do we have H. pylori, which is a bug that can lead to stomach acidity, and it's the bug that leads to ulcers. So we want to look and assess, is this pathogen driven? Is it postural driven? Is it respiratory driven? Is it pathogen driven? Is it lifestyle driven? So you're not even chewing your food, eating too quickly. Are your foods really crappy foods? Is the quality of your foods? So there's a lot. I mean, when you sit down with someone like Dr. Ross, and if I'm a patient, I don't think the patients appreciate the amount of critical thinking that going into, okay, tell me about your diet, tell me how you eat your food, assessing just, are they sitting like this, or is their posture poor? So you're going to assess breathing, posture, how you chew your food, do you have teeth, are you eating poor food? And that's all before it even gets to your stomach. And then when it gets to your stomach, do you have something like an infection like H. pylori, which could be going on? Do you have enough stomach acid? Do you take antacids? And that's, by the way, all before we get to the small intestine, where most of our digestion and absorption occurs, and where leaky gut lives.
Right. And that's where the magic happens, right?
That's where the magic happens. So when we say, hey, we might need to do a further assessment, there's a reason for that. It's not just, oh, here's your pill for this ill. That's not I had a question the other day. Why is so much omeprazole given out for heartburn? I said, because very rarely are they saying, I don't know the mechanism of your heartburn. Is it
Mm,
respiration? Is it posture? Is it the types of food? Are you chewing your food? Are
is
you
it
relaxed?
pathogen?
All those things. Is it a pathogen? You're going in and to be fair, patients are going in saying, I have heartburn, get rid of it.
Right.
And they don't want the full answer. They just want the heartburn. Well,
Right.
you know what? I say we can cut your stomach out and you don't have heartburn anymore, right?
Right.
That's an answer. You can take omeprazole, you can take antacids, and there's your heartburn.
Yeah.
So it can be simple. That's how you can get rid of heartburn.
Yeah.
But for us, we're going to look a lot deeper, which may require some more testing so we get a better answer for a better long-term outcome.
Absolutely. Perfect. And just for our viewers, now we're not absolutely poo-pooing PPIs or certain antacids, because in certain cases they are necessary for a small bit of time. Let's put a big, flasher, small bit of time. It's when patients are using these for years and even months, but years on end, where it becomes a major issue. Now, if someone has a gastric ulcer and they're in excruciating pain and their red blood cells and their hemoglobin and their hematocrit's low and they're some anemic from the ulcer, we're not going to pump more stomach acid into that stomach ulcer. We're going to use that time to use a proton pump inhibitor to help that help that stomach heal, the ulcer heal. We'll probably give some things like glutamine and BPC 157, which we'll talk about later, to help heal that gut, but eventually with the ultimate goal of getting the heck off that proton pump inhibitor, right? Is that right, Chris?
Yeah, the long-term goal would be to restore normal function to the body, and that would not be the use of a proton pump inhibitor. But I would yield to you, there is a time and a place where it's indicated. So we're not telling you if your doctor wrote it to get off of it. That's not what we're saying.
Right.
And we're also not saying that there's no shame in it. It sometimes is necessary. And if you don't get to the underlying steps, or you can't figure out the underlying mechanism, it is at least a really nice bridge to not have heartburn all the time. And so I think that's fair. I think it's fair to say, yes, there are times. The goal, though, is to restore to normal physiology where you don't need a proton pump.
100%. 100%. And as quick as a time frame as possible. So
Right.
let's go into now. We spent, I think, a lot of time in regards to the stomach. So now if you can take that visual periscope here, and we're going to dive now into the small intestine, where Dr. Turnpaugh talked about the villi and the microvilli, right? The things that help to absorb our nutrients, and also our microvilli and villi release like lactase and other enzymes actually in our small intestine. And the analogy that I like to say here when we talk about leaky gut, it's like I always tell my patients, picture your small intestine like a overgrown, luscious grass, right? Long blades of overgrown, luscious grass. And think about someone that's come by and has taken the lawnmower to those long, luscious blades of grass and have mowed them down. That's essentially what has happened with our small intestine. And then for our severe cases, you can get what's called crypt hyperplasia. And basically now think of that as like someone's let off bombs in your small intestine. So instead of the grass being mowed, now between the crypts, we have giant cavities, like if a bomb went off, right? You have a giant cavity. And now that leads for that potential harmful bacteria. As the skin repairs, the harmful bacteria can be trapped into those crypts and can cause for chronic digestive symptoms. So that would be something to be aware of. Dr. Turnpaugh, is there anything you want to add now that we're kind of in that small intestine area and we're in the crux of leaky gut?
Well, that's a loaded question because I would love to
so
talk for
much.
days on this, but
Right.
so I think you did a great job of describing that. So when we get into the small intestine, as you said, you have these villi, microvilli. And a lot of digestion happens here. We're breaking down of foods.
Right.
The border in there, for some people who are heard of like brush border enzymes, is something that's come along recently. And so you can imagine if the way you talked about that grass, think of it as almost like a brush. It looks like a brush too.
Right.
That's how it gets its name, brush border.
Right.
And the brush border enzymes on those, the villi and then the microvilli on there, they create or secrete their own little brush border enzymes, little enzymes that break down disaccharides and little sugars.
Yeah.
So it's also delicate, right? It's hairs and little tiny hairs upon hairs. So this is a fragile, it's highly sensitive, highly specific area of the body that is intended to do really important work. And so we want to keep that environment as happy as possible. And then you said when you get the crypt hyperplasia, so if you get, when these little hairs on the top of they go away, and then all of a sudden these start to go away, then you just get this raw, open area. And sometimes it leads to pain, but sometimes it doesn't. But what it does lead is to not only bacteria getting stuck in there, but things leak in that aren't supposed to leak in, right? So this is the intro to leaky gut. So you have these cells, and I put them together like my knuckles. It's like a lock and stock system here. So it opens up a little bit, some food gets down in, and then it shuts back up. So it allows food to come down through. If, however, and now on top here, these are my villi and microvilli and all that kind of stuff. And when these cells open up too much, where my cells come together, it's actually called a tight junction. For the reason is, it's supposed to be a tight junction. So when your tight junctions open up too much, now pieces of food that are not fully digested, peptides, they'll come into the body and they're not supposed to be there. So, or if this cell just kind of got so irritated it died off, it's almost like missing a tooth, right? You're missing a cell, now you have a big gap there. Yep. Now food can get in as well. And the other thing, which maybe we'll talk about, I don't know that we will, is when you tear this cell apart, and food can actually go down right through the center of the cell. Right. So that's called a transcellular, where it rips right through the cell. So there's paracellular around the cell leaked in, and then there's that's paracellular around the cell, and transcellular went right through the cell. So when you talk about this irritation or this crypt hyperplasia or different things, you open that up or you take a cell away and things come in. And as you alluded to earlier, somewhere people argue, but let's just say between 75 and 90% of our entire immune system lives just below the surface here in our gastro-associated lymphoid tissue, so our gullet. So up here we have all this high-tech work going on, and then down here we have Border Patrol. Border Patrol says, hey, are you supposed to get in? Are you supposed to be here? You're not supposed to be here. So as I kind of say, if you open up this junction or the fence and people are leaking in or food particles are leaking in, down here you have Border Patrol, and Border Patrol says, hey, you're not supposed to be here, and it attacks it. And that initiates the immune response. That initiates the immune system, and that immune system can go anywhere. It's mobile now. It can affect all different areas of the body. So that's really how I describe leaky gut. And then when you get leaky gut, somebody leaks through, the immune system, these are my antibodies, immune system gets activated, that is inflammatory. That leads to inflammation. Mm-hmm. So you could say I get headaches, or my ankle hurts, or my knee hurts, or whatever inflammation you have. My joints are hurting all the time, I have brain fog. That's where they tie it all back to. Well, where did your inflammatory response start? Probably just below the surface, at that border right there when the immune system is activated.
Yep. That was awesome. That was perfect. And for those that aren't aware, what Dr. T is talking about here in regards to that stimulation of the immune system and then eventually attacking joints, skin, thyroid, pancreas, we're now talking about that buzzword of molecular mimicry, right? That's when we start to get into the depths of autoimmune conditions related to the gut. But how do we assess for this would be my next question here. So Doc T, are there a couple of things that you like to do for an assessment here? Or?
So a couple of things. I know we all do it differently, and I'll let you kind of grab the reins here. But I would say this: as the simpleton, not the expert, as the simpleton, I would say, if you have chronic inflammation, if you have an inflammatory response in your body anywhere, if you have autoimmunity anywhere, thyroid condition, your joints are constantly hurting, any autoimmune reaction, or any inflammatory response, I'm going to assume you have leaky gut. I'm just going to assume. Now, there are tests, specific tests that we can get into, which detect changes in these cells that are held together. So we can looking for zonulin and occludin and different things. So there are ways to look at this and assess it. I'm probably going to come in, I'll kind of be a little self-deprecating here and say, I'll be the village idiot. And I'm going to say, I think you have leaky gut. And I'm going to turn the reins over to you to say, all right, so there is really scientifically well-documented, awesome tests to do that can check for these zonulin, occludin pieces, parts, and I'll let you get into that.
Right. Yeah. And so I mean, I completely agree as well. If there's some patients walk in and you're like, there's no point to test. We got to take care of your gut. But some patients want that data. They want that info. And I know you are a data-driven person for how much you get your blood drawn. I know how much you love your data, and I'm a data-driven person as well. So I want the data. Let's go get your poop. Go collect some of your poop, right? So there's a couple of tests out there that are really good. And we make sure we partake in and we use these tests. So there's some tests that give a lot of good information. One of the tests that I run, it covers basically, I tell my patients, listen, this is the best picture of your digestive tract. Other than going and getting a scope endoscopy and getting a colonoscopy, there's really no other best assessment for evaluating stem to stern your digestive tract. And the stool test that I use looks at various bacterial pathogens, whether it's C. diff, Campylobacter, Shigella, E. coli. It looks at what I call water, river, stream pathogens, which is Cryptosporidium, Entamoeba histolytica, Giardia. We get a look at other viral pathogens. The test that myself and Dr. Turnpaugh and our other clinicians at our office run looks at Helicobacter pylori. That's that stomach acid, that parasite that lives in the stomach that can create ulcers and cause more stomach acid. It also looks at good, healthy, normal bacteria. So I call this, I tell my patients, it looks at your flower bed. It tells us, do we have a lot of good, beautiful flowers or a lot of weeds that we need to go and pull out the weeds and do some gardening here? So it gives us a good evaluation. How many flowers do we have in the flower bed? And then we get to look at, which I like, and I take a lot of information from this, is the microbiome and dysbiotic bacteria. So that's, when you hear dysbiotic, just think unhealthy bacteria, right? And this looks at a couple markers that I really like. One being a marker called Pseudomonas aeruginosa. And this is a bacteria that is associated with a biofilm. And I want to know if we have to be fighting against a biofilm, because what biofilms basically do is they take the bacteria, in this case, and they put a shield over it, right? So now it's that much harder to kill. So I want to know if we need to use some things to help remove that shield and expose that bacteria so we can kill it more effectively. Also, this looks at a lot of our gram-negative bacteria, because gram-negative bacteria have something called LPS, lipopolysaccharide, and that's part of the bacteria to help protect it. And as Dr. Turnpaugh knows, and a lot of other practitioners know, how much of a correlation to leaky gut and high levels of LPS, lipopolysaccharide, are connected with that. So it's a high correlation. So this also looks at a lot of our gram-negative bacteria that carry that LPS. A couple other markers here. I'm not going to get too detailed that I like. Again, that Pseudomonas aeruginosa. Another one is Methanobacter. As it says in the name, it actually looks at the production of methane. So now we're kind of getting into that, well, do we have SIBO aspect? But it just gives me a little bit clinical correlation there for producing a lot of methane and getting a lot of gas. We also can look at some autoimmune triggers. So as we talked about the aspect of the immune system, such as our fusobacterium, such as our Klebsiella pneumoniae, obviously, which can affect the respiratory system. But these other markers can affect our cardiovascular system. If it gets incredibly invasive, it can affect the bone. So there's some things that we absolutely want to look at. Our testing also looks at candida, right? If we have yeast overgrowth, right? And then it will look at some other protozoans and other potential worms. And the other couple aspects that I really like here is it looks at your elastase, which is your enzyme production. It looks at your steatocrit, which shows you if you're not absorbing fat, if we're having fat in our stool. We also get to look at if there's having blood in the stool. And another great marker that Doc T mentioned is your calprotectin levels, which some clinicians actually use for a diagnosable condition for ulcerative colitis, diverticulitis, IBD, irritable bowel diseases. So as you can see here, we can get a lot of information just from collecting your stool, and we can do a lot from that, right? So is there anything that you'd want to add there, Doc T?
That was a lot to digest, no pun intended.
Yeah.
That's great. That is the point of there are tests that are accurate in assessing everything we talked about at a cursory level. And so the lipopolysaccharides you talked about, these are these gram-negative bacteria. They're really big and they live in the gut. So if they're in our system, right, if we test for if they're in the blood, then we know that they're getting through the gut wall. The biofilms, which you talked about, it's a huge conversation, which I think deserves probably you and I sitting down for an hour just on biofilms.
Yeah.
But so those biofilms are like fruit jello, right? So the piece of fruit is inside the jello. If we can't get at the bug because we can't get through the jello wall, that makes it hard. Or it's also what I say, like a hornet's nest. When the bees are in the nest, they're not harmful. But when they come out of the nest, that's when they can sting you. But when they're in a biofilm, and if we have biofilms with the Pseudomonas check we have, those biofilms can get bigger and bigger and bigger and bigger. So imagine if you had a hornet's nest in the corner of your office, and they never really came out that much. But every day the hornet's nest got bigger and bigger and bigger till it was like a 5 foot by 5 foot hornet's nest. Well, now when you go to get rid of that hornet's nest, you're more likely to get stung a lot. So if we see that you have these biofilms in your gut, this tells us that it may be a tricky road, right? So we're going to try and eliminate some of these pathogens that may not belong there, but in the way, you may get stung a little bit. So it's not going to be a straight, oh, I went in, got rid of the hornet's nest and didn't get stung. So that's where a little bit of grace has to come in, like, hey, we're doing the best we can, but you got to realize we're removing some nasty bees here. We got to go out and kill off some of this stuff. And it's not as easy as it sounds. So the test is really amazing because it gives an incredibly objective, targeted approach to going through this, as opposed to, hey, go change your diet, or hey, go take this pill. It's a very targeted approach on how to do things.
Exactly. I love it. And then, so if someone is coming in to the office in regards to the biofilm, one of the aspects that I love, and I think Doc T use this pretty regular as well, is I love using biocidin for biofilm disruption, right? Has some bilberry fruit extract. It has the noni, some milk thistle, shiitake mushroom, golden seal, a lot of really good things to help attack and dissolve that biofilm. So that's one thing that I love for our listeners that you could look into is biocidin. If I'm coming in, Doc, with which I think leaky gut is, I know I'm going to be talking about my diet. We're going to be correcting my diet. We're going to be talking about being conscious while I eat. We're going to be talking about correcting my posture and correcting my breathing. What else would you say? What would be some other tips to help heal my gut and get my gut back on track?
Yeah, so you talked about biofilm disruption, and Biocidin is a great one. Biodisrupt is another product that people can use. It's actually Biocidin is less natural to think of Biocene doesn't sound like biofilm, but it really works great for it.
Right.
Biodisrupt is a biofilm disruptor. Those are great products. I think that you have to repair the gut wall, but you also have to look at this massive test and see what needs to be removed.
Right.
So what kind of bugs are in there that need to go? They don't belong there. So we got to get rid of the bad apples that are in there and get rid of them. So we might have to do some things to kill off some of the nasty bugs that are not supposed to be there. We may have to re-inoculate or put healthy bugs back in there.
Mm-hmm.
And we have to certainly repair those tissues that have been damaged. And so there's a product that I personally love. It's called GI Foundations, and it's the foundation of your GI health. So it has things like glutamine, deglycerized licorice, and aloe powder. It's a foundational product to help heal up the gut. I think there's a large topic of probiotics. There's a large topic of what we call critter kill. So it kills off the bad guys that don't belong there. There's a product that is called GI Synergy, and it kind of takes care of all the critters that live in there. You could do a yeast kill. You can use a yeast product. There's something for yeast, something for protozoa, if the protozoa kicked up, amoebas and different things.
Right.
So you got to kill the bad guys.
Right.
You got to make sure that's not the reason for the bad environment. You got to repair the damage that's been done. So if you have a cut on your hand, you got to repair it. You can't keep insulting it. And then you want to get re-inoculated with healthy, friendly probiotics that live in there. And then make sure all the way down the back end of the colon that those colonocytes, those colon cells are happy with. And we didn't touch on this too much, but the colonocytes are happy when they get something called a short chain fatty acid.
Yep.
And short chain fatty acids are really vegetable fibers.
Mm-hmm.
So how do I get vegetable fibers broken all the way down so my colon stays happy? Well, that is dependent upon the digestion that happens in the small intestine.
Yeah.
So if you don't break down your vegetables all the way to the little fibers, many times we'll support you with some butyric acid, a product called sunbutyrate or enterovite. There are two different products that have short chain fatty acids in it to help. So, I'll let you speak on the specifics of the names of the products, but that's kind of the process, right? Is that what you're looking for?
Yeah, that's it. That's awesome. And I think that was perfect, making sure we're trying to heal that gut, GI Foundations, making sure we're trying to remove.
And I'll interject. I'm sorry. A lot of our clinicians also use GI Core because it tends to taste a little bit better.
Yeah.
So there's a lot of products for that.
Yeah, we have a few that help. Basically, my analogy is kind of re-slather the concrete back over that brick wall.
Right.
But nailed it perfectly with that. I love that. And then, what is ticking off that digestive tract? Is it a pathogen of some sort, whether it's a gram-negative bacteria, whether it's a protozoa, whether it's yeast, et cetera, and trying, to kill that pathogen. And then making sure we're re-inoculating with good, healthy probiotics. And I know we talked briefly before this. We both like because I know probiotics is a very high topic of interest. And we both talked about, for our viewers, we like cycling through different probiotics. One of my gold standards for me is that the probiotic needs to be at least 5 billion culture forming units with at least 3 to 4 different strains of probiotics. And then I usually cycle through I usually change my probiotic type about every 3 months, a quarter to every 2 quarters, something like that. Anything you wanted to mention there, Dr. Turnpaugh?
I think that's a pretty fair assessment. I think people come in and they say, this is the magic probiotic for me. And even if it was effective at the time, in nature, you would have gotten different bugs at different times from different foods. Mm-hmm. Your core you got from mom when you were born through the vaginal wall, unless you were a C-section. But if you were not a C-section, your core flora that belong in your gut are from mom's vaginal cavity. And so you're getting them right then and there. And so the other ones they're either friendly, but you can have different friends along the way. So I think mixing it up is a good idea. A lot of people want to put, this is the magic probiotic, and we're as variable as probiotics are. So, you and I, we don't look the same, we're different heights, different hair colors, different hair. So the probiotics are the same. And I think a wide variety is pretty good. There's a couple that have been used for some clinical indication, like the rhamnosus and different things.
Yeah.
But I think you're right on the money. Do one for a while, a good one that has a healthy amount of 5 billion colony forming units with at least 3 different strains makes sense to me. Now from there you can go up to 350 billion colony forming units. There's all different varieties and types of that. However, I think it's important to say at some point, switch it up at some point.
Yeah. Agreed. I love that. And then we can talk more about this. We're going to get wrapping up here, but I just wanted to have our viewers at least hear this. And if you want to talk more about, I know Dr. Turnpaugh would love to, because I think he's the peptide guru. But a really so some of my really hard leaky gut digestive issue cases, using something called a peptide called BPC 157 has been really helpful. In oral enterically coated capsule has been really helpful for helping to build that luscious grass back up, those microvilli and villi. So that's a really nice tool, which is an amino acid that's formulated specifically to help repair tissue. We can talk into that more details, and Doc T, if you want to mention anything with that. But
I'm glad you circled back to that, because honestly, it went out of my head and I should have said something about it. So BPC stands for body protective compound. So that right there is, and it's a peptide. It's a gastric peptide that our bodies actually make. So we make this BPC. We take it orally, and it helps to heal that gut up. And it's something that our body already has that we're already facilitating. Just an amazing peptide that when you take it orally helps to repair the gut. Again, it's something our body already makes, and it's a gastric peptide that our body makes to help heal things up. And when it needs a little bit extra, it just can't make enough, and that's when we supplement the body protective compounds. So the BPC 157, just amazing for helping the gut.
Yeah, I've seen great results with that. Is there anything else that you want to add here, Dr. T?
I think one of the key takeaways is you can have leaky gut in the absence of gut issues. So people need to know that. You mentioned that right in the beginning. You don't have to have a gut issue. You can have any inflammatory response, and you have to at least rule out leaky gut. This can come from any mood disorder, depression, anxiety, all those things can be gut. When your body's under stress, it's fight or flight, not digestion and repair. So people with high stress need to assess leaky gut. Right. I think it's very important to not take this lightly. Leaky gut is not just, leaky gut, take this, it's fixed. Right. As you mentioned, you went down that scientific hole. There's a lot to it. There's a lot more to it than we tend to give it the credit for. So there's a lot to it. It's a cornerstone of all of your immune system and your nervous system and your brain working correctly. Right. And it's not as simple as here's the answer, but it leads to so many other health conditions that leaky gut should be considered in anybody with any kind of chronic, I don't feel good condition.
Right, exactly. And not to mention that we touched upon briefly, about 70 to 80% of your serotonin is made in the gut, right? That's huge.
At least. And off of the gut, you can develop the things that we've heard, adrenal insufficiency. You can develop SIBO. You can develop constipation, diarrhea. Obviously, you can develop thyroid conditions, brain, mood disorders, eczema, hormones. Your hormones have to be bound by bile salts. If they're too busy binding other toxins and things, so you may say, well, I have estrogen dominance, and that has to be, well, do you make enough bile? Do you have enough stomach acid to make enough bile to bind the hormones to get rid of them? So, we use something, I know we both use a lot of calcium D-glucarate, which binds these things to help the hormones. That can be done naturally through your bile salts if you have healthy digestion and you don't have these gut dysfunctions. So anything from hormones to SIBO, to thyroid, to mood, to eczema, to sleep patterns, to cortisol, to energy, to all those things has to be at least a piece of your leaky gut has to be assessed. So people think, why am I talking about leaky gut? I have adrenal fatigue. Well, why do you have adrenal fatigue? I have hormone issues. My periods are off. My hormones are off. My testosterone's off. I'm depressed. I'm anxious. I have eczema. What does that have to do with it? It all has some, I think just the point of why we've probably focused so much energy on this is because leaky gut is tied to all that.
Right. It's so crucial. And this isn't to overwhelm you and be like, oh my gosh, what am I going to do? It's just to bring awareness that, hey, if you're out there, you're listening to this and you haven't had a good evaluation on your gut, probably, give the office a call or find, if you want, find a provider that's local to you, but get assessed, get it checked out.
And I want to interrupt you. Sorry, Dr. Ross.
No problem.
We talked about this before. It starts not with just chewing. It starts with what you're deciding to chew.
Right.
So, we did our last one on gluten and foods. Foods can be irritants in of themselves. So what you choose to put in your environment, the food you choose is the starting point. And I know we talked about that the last talk, but it carries right over to this.
Exactly. Yeah. And that's for our viewers. That's why we didn't really harp too much on the foods, because we did go in such a detail in regards to gluten and other inflammatory foods. I mean, for our viewers here who follow us, they should know by now that's a no brainer. But if you're not aware, that's fine. Go listen to our podcast on gluten, and that will be able to fill you in. Anything else there, Dr. Turnpaugh, for you?
I think we've done, we've taken a 3-month lecture and squeezed it pretty effectively into, this one little talk.
Yeah, it was great. So thank you for our viewers to take the time to listen to this. Please don't hesitate to like our podcast here, and also head to our YouTube page, Turnpaugh Health and Wellness Center, to get all of our content that is there as well. And you can also subscribe to our emails to get daily emails and full of content. And then if you're wondering how you contact ourselves, you go to www.Turnpaugh HWC. So that's www.turnpaughhwc.com, or you can call one of our many offices, 717-795-9566, 717-879-9899. And we're happy to help here. Chris, been a great talk as always.
Great talk. And the last piece, which we're in sense of service, right? So we want to serve the community. If the community, we say this all the time, but if the community has a suggestion for us to reach out to, if you're a listener and like, hey, I want to know more about XYZ, we'll dig into it.
Absolutely.
We're
nerds. We love researching more and more, don't we?
Absolutely. This is our free time. Yeah.
Awesome. Thanks, Chris, for your time. And for our viewers, thanks for listening, and tune into our next podcast.
Thanks so much.